Committee on Civil Law and Bad Practices. The first bill up this evening. Well, first of all, I'd like to thank Representative Smith and Representative Vogel for the pizza. Thank you very much for feeding us. Very delicious. And Representative Sanders, I will move House File 840 that it be re-referred to Public Safety and Crime Prevention. Representative Sanders.
Thank you, Madam Chair. This is right now the Elections Policy Omnibus Bill, and I believe this is the last leg of the policy journey. So we're here today to talk about some penalties that are in the bill, Madam Chair. And I have with me Ms. Strother from the Secretary of State's office if we have any specific questions.
Okay. Mr. Gehring or Ms. Mullen, can you tell us which parts of this bill apply to our committee?
Madam Chair and members, Section 7 in Article 1 of the bill relates to use of Department of Public Safety data. And Representative Sanders indicated some penalties, and I might need some guidance from him on which ones to think of.
Okay. All right.
Madam Chair, it should be Section 8 on page 6.
Okay.
Under the investigation prosecution portion. But if that's, yeah.
Very good. Does your testifier, is she here to answer questions, or is she actually going to came ready to present?
Madam Chair, Julie Strother with the Office of the Secretary of State. I would just say one quick thing. If Section 7 of Article 1 is included in the jurisdiction of this committee, is that was said. What this does really, it had some language, if you look on 6.11 to 6.15, that talked about the transition time on how we deal with data. That's old language that's not needed. At the end of it, you see it says that the Secretary of State must provide electronic list to the counties at least monthly. We've taken that at least monthly and moved it into the body on 6.8. So we've gotten rid of that transition language and moved up the requirement.
Very good. Thank you. Members, are there any questions? Is there anyone in the audience wishing to testify on behalf of this bill? Seeing none. Representative Sanders, I renew my motion that House File 840 be re-referred to the Committee on Public Safety and Crime Prevention. All those in favor, please signify by saying aye. Aye. Opposed, same sign. You're on your way to public safety. Thank you, Representative Sanders. Members, the next order of business is House File 1187. Representative Franson. Welcome to the committee, Representative Franson.
Thank you, Madam Chair, members.
I will move House File 1187 that it be re-referred to the General Register. Representative Franson, let me find the packet. Do you have any amendments?
I do have an A1 amendment, Madam Chair.
All right, I will move the A1 amendment. Any discussion on the A1 amendment? I'm not sure we have it in our packets, do we? Oh, the amendments are in a different packet. Thank you. Any questions or discussion on the A1? Seeing none, all those in favor of adopting the A1 to get the bill in the shape that the author wishes, please signify by saying aye. Aye. Opposed, same sign. You should be ready to go, Representative Franson. Go ahead and present your bill.
Thank you, Madam Chair and members. This was brought to me from a constituent in Otter Tail County. This bill, well, I'm going to allow Ron to describe the actual bill for you because there's quite a history behind equity stripping, and then I'll go on to the situation in my district.
Thank you. Go ahead and present say your name for the tape and present your testimony.
Thank you, Madam Chair and members. Ron Elwood with Legal Aid. This bill actually provides protections for family farmers that are now only available for individual homeowners who are in foreclosure. This is it protects these family farmers from so-called equity stripping scams. And you might ask, what does that mean? And so briefly, I will just quickly explain it. This is really a swindle where speculators, unscrupulous speculators, seeing a large equity stake in somebody's home and somebody in foreclosure, approaches the homeowner, and if this bill passes, it would be a farmer, to say, I can save your home. Here's the deal. You deed me over your property, and in return, I will sell it back to you on a contract for deed or some sort of a rental arrangement until you get back on your feet. These deals are invariably structured to fail, so that once you've given away your home, you don't have any longer the protections of the foreclosure laws in Minnesota, and instead you can be out in 60 days or as little as 14 days if you were renting the property. In 2004, this was a rampant problem dealing with homeowners as the foreclosure crisis was ramping up. At that time, the Governor Palente's office, the Department of Commerce, the Attorney General, and other stakeholders came together to pass what's known as the Equity Stripping Law, Chapter 325N, and this bill simply says a farmer and the farm property, if subjected to the same kind of scam, will now be covered by the protections that we now have in Chapter 325. And I would wholeheartedly endorse the committee to support this bill.
Thank you, Mr. Elwood. You're adding some new portions to the already in existence statute on this issue so that it applies to farming as well, and it didn't apply to farming before, or
Madam Chair and members of the committee, it didn't expressly exclude the farm house, but it also didn't expressly include it.
Okay.
But what it did not certainly include under the definition was the farm property. And so this would be including not only the house in which the family farmer and the family resides, but also the agricultural property associated with the farm.
Very good, thank you. Members, any questions for the testifier? Representative Franson, did you want to tell about the situation quickly in your district?
Actually, I have a gentleman here that will be able to talk more about his situation that he has experienced.
Thank you for being here. Welcome to the committee. If you want to state your name for the record, that would be great. Go ahead with your testimony.
Thank you very much. My name is Ken Roseland. Thank you for this opportunity. I am a farmer, northern Pine County, southern Carlton County. I have been a farmer all my life. I was born and raised there. We do need this protection. Our farms have increased in value, so therefore they're more lucrative. I do have some neighbors that have fallen into the same practice. They will not speak about it. That's very unfortunate. All we're asking for is the same protection that's afforded our counterparts in the cities. Thank you very much.
Thank you for your testimony. Are there any member questions? Is there anyone in the audience wishing to testify on this bill? Seeing none, I will renew my motion that House File 1187 as amended be re-referred to the General Register. All those in favor, please signify by saying aye. Aye. Opposed, same sign. Thank you, Representative Franson. Your bill's on the way to the General
Thank you, members.
Register.
Thank you, Madam Chair.
We're going to go a bit out of order right now. Representative Drazkowski, we're going to go ahead and hear your bill. House File 1460. Members. Representative Drazkowski, I will move House File 1460 and recommend that it be re-referred to the Health and Human Services Finance Committee.
Thank you,
Go
Madam.
ahead with your bill, please.
Thank you, Madam Chair and members. House File 1460 was born out of, at least partially out of an effort that began about a year and a half ago now, when I and other members had some interaction via letter with the Department of Human Services, and actually the Commissioner, about the efforts put forward around income eligibility of the cases and the individuals who are part of our state's Medicaid system, both MinnesotaCare and Medical Assistance, that comprise about $10 billion per year in state and federal spending. And the state, the Office of Legislative Auditor has conducted at least 2 actual audits on this eligibility effort within our state, had some other unofficial efforts that he has done, and essentially our eligibility auditing efforts in the state have suffered, as of the November 12th of 2014 audit, a very low score. And so what we saw in that audit was that in the area of 17% of the people who are in the programs are somehow ineligible or signed up for programs they shouldn't be or in a way they shouldn't be. Of that, I think about 8% were actually income ineligible for the programs they were in. And members in other states, the 2 most recent are both Pennsylvania and Illinois. They have conducted outside eligibility audits where a vendor from the private sector has used their more robust efforts to go through the medical assistance in Minnesota, or the Medicaid rolls in those states, and determine whether the people were eligible or not, and then they send back to their state government the list of people who they have determined are very likely not eligible for the programs they're signed up for. So members, this bill has gone through the HHS Reform Committee. Yesterday was the Government Operations Committee. It's here, and hopefully the next stop will be the HHS Finance Committee. There's one provision that your committee would be especially interested in, and it's a provision we added into the bill about data privacy. And I don't have the current version of the bill in front of me, Madam Chair, but it's on the first page of the bill under Section 1, if I remember correctly. Here it is, line 1.17 through 1.19, Madam Chair.
Okay. I'm sorry, Representative Drazkowski, do you have those line numbers again?
1.17 through
Okay.
1.19.
Okay, very good, very good. Any committee questions, member questions? Representative Pinto.
Thank you, Madam Chair. Representative Drazkowski, do you know what DHS or MinSure have to say about this? Or have they taken a position or provided any thoughts on it?
Representative Drazkowski.
Thank you, Madam Chair. Representative Pinto. I spoke with them a couple of times in the last few days, and a number of them in my office today. They have committed to working with us to get this in the best shape it can. They have also acknowledged that they believe that they've made improvements since the November audit. Of course, as we look back in history, this department has said that numerous times, and the legislative auditor has a good trail of that. While we support their efforts to do that, we need to make certain that it's actually happening. And the savings, members, and Representative Pinto, that Illinois saw were significant, and they're still debating the amount of the savings there, somewhere between $100 and $200 million a year for a state that's about twice as large as our state. And they are looking at returns on investment of either 10 to 1 or 5 to 1, depending on the recovery that they end up with.
Representative Pinto.
Thank you, Madam Chair. And I just want to say we certainly want to make sure people receiving government programs are eligible to do so. So thank you for bringing this forward. Thanks.
Any other member questions? Thank you. Representative Drazkowski, I will renew my motion. Wait, do you have any testifiers?
I do not. The testifier, Madam Chair, I had is not able to make it tonight.
All right. Anyone in the audience wishing to come forward and testify on this bill? Seeing no one, I will renew my motion that House File 1460 be re-referred to the Committee on Health and Human Services Finance. All those in favor, please signify by saying aye. Aye. Opposed, same sign. You're on your way. Thank you, Representative Drazkowski.
Thank you, Madam Chair and members.
Representative Quam, you are up next. House File 1232. We'll take that one first. Representative Quam. Give us a moment. We got a big stack here to go through to find it. All right. All right, Representative Quam, go ahead with, I will move House File 1232 and recommend that it be re-referred to the Committee on Public Safety and Crime Prevention.
Thank you, Madam Chair. And I do have some testifiers available for questions, and I wasn't sure if this committee had a specific section that they were interested in for their peer review.
Thank you, Representative Quam. We will have Representative Gehring, or Mr. Gehring, tell us what areas of the bill that we need to focus on.
Madam Chair and members, so this is another bill related to data privacy issues. On Section 1, on page 1, is an amendment to Chapter 13 related to protection of identities of individuals who are victims of sex trafficking. Then additionally, later in the bill, there's a couple of sections that relate to protection of identities, including Section 7 on page 6.
Representative Quam, if you and your testifiers could focus on those areas of the bill, that would be fantastic.
Well, thank you, Madam Chair. And so I'm bringing the testifier down to hit that. But just in general, this bill is an update to conform with different languages, or, that are now more prevalent in usage in law, and does contain some additional penalties, of course, which are outside the purview of this committee. And I'd like the specifics on data privacy to be addressed by my testifier.
Okay, very good. Please introduce yourself for the committee and go ahead with your testimony.
Thank you, Madam Chair. My name is Caroline Palmer, and I'm the Law and Policy Manager at the Minnesota Coalition Against Sexual Assault. We represent 60 sexual assault advocacy programs across the state, and many of them do serve victims of sex trafficking and exploitation. I'll just be brief and just address the two parts that have to do with identity and privacy. The first section does create a limit on the release of law enforcement to protect the identity of sex trafficking victims. Currently in statute, we already have that protection for victims of sexual assault, so it seemed fitting to add sex trafficking victims to that same protection. And the other section actually does address, again, protection of identities for a victim of sex trafficking. Again, in Section 7, it's about expanding records protections. It does protect sexual assault victims already. Again, it seemed to make sense to add trafficking victims.
Fantastic, thank you. Any questions for this testifier? Okay, seeing none. Are there any other testifiers that you wish to have come forward to address this section of the bill, or sections of the bill, Representative Quam?
Madam Chair, not unless there are specific questions that would require it.
All right, fantastic. Anyone in the audience wishing to testify for or against this bill? Seeing none, I will remove my motion that, oh, I'm sorry, Representative Pinto.
Thank you, Madam Chair. And being in the Lesh and Hillstrom position, I think, has inspired me to speak more often, so my apologies. Hopefully a lot shorter than the day. I just, in full disclosure, I was involved in putting this bill together last year when I was a prosecutor before being elected to the legislature, so just wanted the committee to be aware of that, and am fully supportive of and appreciate Representative Quam for his leadership. That's all. Thanks.
Thank you for your help with that. And thank you, Representative Quam, and to your testifier, thank you for a good bill. And I will renew my motion that House File 1232 be re-referred to the Committee on Public Safety and Crime Prevention. All those in favor, please signify by saying aye. Aye. Opposed, nay. You're on your way. The motion prevails. Representative Quam.
Thank you, Madam Chair.
And we'll move on to House File 1271.
Thank you, Madam Chair. And again, if needed, we could have someone touch on some bases. I believe what is in the purview of this committee are because we have background checks. And, basically, the state is providing nearly all the funding that's in here. And because staff has access to the client's rooms, and there is the possible of exposure if a client was preyed upon by staff, it's prudent to have appropriate background checks to ensure, the safety of the clients. And that's why we have it present in this bill.
Any member discussion? And again, I believe you said your testifiers would come forward only if needed. Is that correct, Representative Quam?
For the, I do not want to impose upon the committee's time any more than is required.
All right. No, seeing no member discussion, is there anyone in the audience wishing to testify for or against this bill? Seeing no one, I will renew my motion that House File 1271 be, I don't think I actually said this in the beginning, be re-referred to the Committee on Job Growth, Energy, and Energy Affordability. All those in favor, please signify by saying aye. Aye. Opposed, nay. House File 1271 the motion is adopted, and it's on its way to Job Growth and Energy Affordability. Thank you, Representative Quam.
Thank you, Madam Chair and members, for hearing my 3 bills today.
Thank you. Representative Baker.
Madam Chair, if I could just address the committee real quick. One of my expert testifiers is actually testifying right now in a room downstairs. Would it be okay if I skip my turn until he gets up here? Would that be all right with the chair or not?
Certainly. Is Representative Barrett in the room? Oh, well, then let's move. I don't see him, but let's go to Representative Pierson, rather.
Thank you, Madam Chair.
He's in the room, so we'll do that and come back to Representative Baker's bill. 1936, members. House File 1936.
Madam Chair, thank you.
Well, thank you for being here, Representative Pierson. And once again, we have another freshman that didn't get the memo about the change in House rules about tweets. First time in any committee. We'll be all here tomorrow. Or no, they won't be, but I will be.
All right.
Next
good,
week we'll be around. So
Good to know. Thank you.
yes, Representative Pierson. Representative Vogel, would you like to move House File 1936?
Yes, assuming the treats come.
A little blackmail.
You have pizza. It's something we don't see very often.
Also brought to us by freshmen voluntarily,
Aha.
without being asked. So,
glad to go with it, Madam Chair.
thank you, Representative Vogel. And House File 1936 is recommended to be re-referred to Health and Human Services Finance. Go ahead and present your bill.
Thank you very much. Actually, it's very appropriate that this comes very close to the Drazkowski bill. Runs real parallel. In fact, the amended language that's pertinent, I think, to this committee is verbatim the same, and you can find that on line 2.7. This bill is, again, trying to verify eligibility for programs. Specifically here, we're talking about MinnesotaCare. And so this is a little bit of a different way of going about doing that by asking for a request for a proposal from a vendor to provide that service to the state, and then again to the point of the data practices and making sure that all of that information is safe. We've got that language added in 2.7.
Great, I appreciate that. Is there any member, are there any member questions? Representative Pinto.
Thank you,
I'll
Madam
just
Chair.
make it a habit to look over your way.
Thank you, Madam Chair. I'm just understanding is this sort of parallel to Representative Drazkowski's bill that we?
It is. It's a little different structure. I'm sorry,
Pearson.
Madam Chair. Thank you, Representative Pinto. Structurally, we're asking for an RFP for an outside vendor. He's asking for an allocation of funds. Sorry, I'm blanking on the word. Maybe that is the word, but we're not asking for an allotment of funds from the budget. All of the funding for this would actually come from the findings of the savings for getting people off that don't belong on MinnesotaCare.
Representative Pinto.
Thank you, Madam Chair. So this would be paid for using the savings that the vendor would find, and if so, I guess, what if it doesn't, I was trying to think about.
Then there's no-
Yeah, if overage or under and how all that would work. You understand what I'm asking, I think.
Pearson.
Yeah, thank you, Madam Chair and Representative Pinto. If they don't find any, then they're not compensated. So the vendor will be very careful to select this opportunity or not.
Representative Pinto.
Thank you, Madam Chair. And if they find a lot, then they keep the whole amount of what they find, or is there some, how does that work?
Representative Pearson.
Structurally, I believe this is kind of done in a cost savings percentage type of a finder's fee paid as a percentage. Looking at the Office of Legislative Auditor in this specific instance, we've found an error rating of about 17%, which is a great opportunity, again, like you were stating earlier on the Drazkowski amendment, of taking people off the rolls that do not qualify. And this bill contemplates structuring that in a different fashion than Representative Drazkowski's, but it has the same intent.
Very good. Any other member questions? Seeing none, is there anyone in the audience wishing to testify on this bill? Seeing no one, Representative Vogel will renew his motion that House File 1936 be re-referred to the Committee on Health and Human Services Finance. All those in favor, please signify by saying aye. Aye. Opposed, nay. The motion prevails. The bill is on its way to Health and Human Services Finance. Thank you, Representative Pearson.
Thank you, Madam Chair.
Don't come back
And committee.
empty-handed next time. We are going to skip to Representative Barrett's bill now. Representative Zerwas, would you like to move House File 1209? Yes, he would. He's shaking his head, for those of you that can't hear on the tape. And he's asking that it be re-referred to the Committee on Health and Human Services Finance. Welcome to the committee, Representative Barrett.
Thank you, Madam Chair.
Are there specific areas of this bill that pertain to our committee? Mr. Gehring.
Madam Chair and members, on page 5, section 3, there's a section related to collection and reporting of suicide data.
Thank you. Representative Barrett, then, if you could just speak to section 5. I believe that's what you said, right? Yeah, section 5 of the bill. Oh, section 3. There it is. Yes, I'm sorry. Section 3 on page 5. If you could just keep your remarks to that section that applies to our committee, that would be helpful. Thank you very much.
Sounds good, Madam Chair. With me today is Sue Abderholden from National Association on Mental Illness, Minnesota chapter, who would like to speak to this section.
Very fine. Thank you for being here. Please state your name for the record, and please continue.
Thank you, Madam Chair, members. For the record, Sue Abderholden with NAMI, Minnesota. What this section does is it doesn't expand what you're collecting. It's actually having the commissioner work with some stakeholders to figure out how can we improve the timelines. Right now, I can tell you how many people have Ebola in Africa. I can't tell you today how many people died by suicide last month in Hennepin County, or the month before that, or the month before that, or the month before that. If it's a public health problem, we really need to be able to respond more quickly to it. So this would have the commissioner work with the stakeholders to figure out how can we improve the timeliness, what about the quality of the data. The Center for the Minnesota Violent Death Reporting System is actually working with states to figure out a better way to do that. And then come back actually in 2016 with a report. So it doesn't open up access to any existing data. It really is to try to look at how can we do this differently so that we can use that data to actually reduce the number of deaths in Minnesota, which actually has been rising over the last decade.
Thank you for your testimony. Do you have specific data sets that you would like to be collecting data on, or are you already collecting a certain amount of data? How is this working? Because we want to make sure that we identify the data that you are collecting and what it's going to be used for.
Madam Chair, members, currently the Department of Health does collect suicide data as part of the mortality data, how many people died by suicide or accidents or heart disease. So that data is already being collected, and what we want to do is see if we can have kind of a better and faster data collection system. So again, this isn't expanding it in any way. It's a group that's going to look at it and come back to you.
And Ms. Abderholden, is that correct?
Yes.
Yes. Ms. Abderholden, is there any personally identifying information in the data that you collect?
Madam Chair, I know there's someone from the Department of Health who might be able to answer that better than I can.
Okay, that'd be great. Come on down. Welcome to the committee. Please state your name for the record, and if you could answer that question, that would be helpful.
Thanks, Madam Chair and members. Mark Kindy, Minnesota Department of Health Injury and Violence Prevention Program. Yes, there is identifiable data. The death certificate data are public, and my name will appear at some juncture on a death certificate. So identifying data is analyzed, is collected. All of that is aggregated, and none of that is released.
All right, thank you.
Thank you.
Other member questions? Representative Barrett, I see you have another testifier. Was he just your phone a friend, or did he have come prepared to testify this evening?
Yeah, he'd be happy to. I know you have a lot of bills on the calendar. We have been at 3 committees, I believe, and talked a lot about suicide prevention, the need, if you have interest in why this bill in total is necessary. My testifier, Sean Haynes, would be happy to talk to that.
Okay.
If not, because of interest of time, I totally understand.
Very good. Well, thank you for being here this evening. And any member questions at all on this bill? Thank you for being available. Any members of the audience wishing to testify on this bill? Seeing none, Representative Zerwas will renew his motion that House File 1209 be re-referred to the Health and Human Services Finance Committee. All those in favor, please signify by saying aye. 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 Opposed, nay. The motion is adopted. The motion is adopted. You're on your way, Representative Baker, to Health and Human Services. Thank you so much.
Thank you, Madam Chair.
Representative Baker. Welcome to the committee.
Thank you very much, Madam Chair and committee, and again, thank you for allowing us to be reassigned tonight. And as a freshman, I'm sorry I let you down as well. I will make it up somehow, I promise.
Okay, very
Okay.
good.
Cupcakes are good.
Yeah, okay. Again, Madam Chair and members of the committee, I bring to you House File 1652. This is a bill that talks about the prescription monitoring program, which is, I think, a very good program. It is used in a lot of states. I have learned very quickly, both from a personal experience a few years ago to also when I arrived here at my office in this wonderful life that we are living in now, how important and how critical information is to give good information to see if programs actually work. So what this file does, this came to me from the department, actually the Board of Pharmacy brought this to me after the legislature wanted more information on how this stuff is really working. How is the system, how is the program working? And through this journey, we have, and I have, learned a ton. I've learned how important information is to move too quickly, too fast, and how much is appropriate from a patient's rights standpoint. And today, Madam Chair, the bill in front of you, I'm also including, there should have been an amendment with this as well. That was included into the packet. So I want to strike, as you'll see the amendment, the A2 amendment, modifies it and basically takes out the part of the patient consent that was originally stricken from the bill. We want that put back in so that prescribers and pharmacists and are going to use the law as it is today. So the consent part of that must still be done by the patient, with the exception of when you're in an emergency situation and you're unconscious in the emergency room. That's how the bill still reads it. But I wanted to make sure that that was part of today's conversation. So and I'd like to make a final statement at the end if I could, Madam Chair. I'll turn it over to the folks from the Board of Pharmacy and from the Department of Health. And if I could, I'll turn it over to my experts, and they'll step you through the bill fairly quickly. Thank you.
Thank you, Representative Baker. We do need to move your bill. Representative Smith moves House File 1652. and recommend that it be re-referred to Health and Human Services Finance Committee.
As
You can
amended.
Go ahead and have your testifier. Oh, you know what? We need to do the A1.
Thank you.
And and Madam Chair, can I just ask what the impetus for the amendment is? Just because I think it'll help sort of understanding for the bill as a whole. Kind of what was it coming from a prior concern expressed in a prior committee or something like that?
It was coming from a concern of me.
Yep.
Okay.
Me.
Well, thank you, Madam Chair.
And just a little history on this whole study. There was a grand compromise reached either a year ago or 2 years ago on this study. And the language that is being stricken from here is language that was part of that grand compromise, and then they've added language to it. So I'm still not highly comfortable with this bill, but I did talk to Representative Baker this afternoon and say we really need to put this consent information back in. I'm a stickler on patients having consent, having the ability to sign a document giving consent. So that's the genesis of this. Thank you. All right, Representative Baker, if your testifier could go ahead and introduce his or herself and continue with your testimony.
Madam Chair, members of the committee, my name is Dr. Cody Weiberg. I'm the Executive Director of the Minnesota Board of Pharmacy, which is the agency that administers the prescription monitoring program. And basically, we understand, the board understands, that the legislature in this particular instance is faced with essentially two very important public policy issues. One is prescription drug abuse, and that's what this program is designed to help prevent. It is only one of many tools. We work together with the Department of Human Services, that's here, the Department of Health, many other public agencies, on a variety of different tools that we hope will work together to reduce prescription drug abuse, which, according to the Department of Health statistics, is taking the life of one Minnesotan every other day. In addition to that, another Minnesotan dies every 4 days from heroin abuse, and many of the people that get addicted to heroin start with prescription drugs. So that is the one issue. The other issue is definitely data privacy and data security. When I was asked 10 years ago to work on this, start working on this by Senator Linda Berglund and Representative Jim Abler, my top two concerns were that if we didn't do it right, we'd have a chilling effect on appropriate prescribing, and people that really needed pain medications, like my wife, who's a chronic pain patient, wouldn't get them. And I was very concerned about data security and privacy, and who wouldn't be if you're the head of an agency that has this sort of data in an age when Sony Corporation and Target Corporation can have their databases hacked. So we definitely are concerned about that, and I understand that there is that balance that has to be struck. I guess what I'd like to talk about a little bit about this process is because sometimes this is characterized as a board bill, which it is, because as the agency that brings the bill forward, we certainly are responsible for this legislation. But we actually work with a wide variety of organizations. We have a prescription monitoring program advisory task force that consists of all the other licensing boards that license prescribers, the Department of Health, the Department of Human Services, all of the professional associations that represent pharmacists and prescribers. We have two public members, one that focuses on data privacy issues, Mr. Rich Neumeister, who's probably here tonight, and another public member that focuses on drug abuse issues. We certainly work as part of what's called the State Substance Abuse Strategy, spearheaded by the Department of Human Services, but which also includes the Departments of Health, Education, Corrections, Public Safety, the Board of Pharmacy. At one point, we even had the state courts and the Minnesota National Guard in on the talk. And we have a coordinated strategy for dealing with all sorts of substance abuse, including prescription drug abuse. So this bill is actually not simply a Board of Pharmacy bill. It's a result of consultations with all of those other entities and a considerable amount of research into what federal agencies are recommending as well. So the provisions of the bill that are relevant to the committee. Representative Baker actually just amended a couple of those out. I'll talk about those briefly because I think DHS may want to talk about those. Those would have allowed pharmacists and prescribers to look at the data for purposes other than dispensing and prescribing or other than emergency purposes without consent. And I will just give you just one brief example of a situation where that might be very useful, because we also listen to the feedback of the users of the systems, and we had a pharmacist call us who works as part of a transplant team in one of the large healthcare systems here in the Twin Cities. When you're going to do a liver transplant, you evaluate the patient for the appropriateness for the transplant. One of the things you want to know is if that person is a drug abuser, because drug abuse can destroy a liver. And they had screened this person. They were not considering prescribing any controlled substances, so they could not look at the PMP database. The individual denied having any sort of problems whatsoever with drug abuse. Got a liver transplant, and now, of course, needed pain medications for the operation. When they looked in the database, the individual had been abusing controlled substances containing Tylenol, which are particularly damaging to the liver, right up to the day before the operation. One of the points that has been made, I think, in one of the other committees, either here in the Senate, is if any of you have had loved ones who are chemically dependent, and unfortunately my family has a history of chemical dependency, people who are chemically dependent very often minimize their behavior, even to themselves, and they're not necessarily going to want to consent if they think it's going to have an impact on their ability to get the drug they want to use. And there are other situations where the PMP data could be used with a process that's known as SFIRT, which is screening, brief intervention, and referral to treatment, which is a screening tool practitioners can use, and I think DHS is trying to encourage practitioners to use, to try to identify people early on in the drug abuse process to get them into appropriate treatment. So that is the sort of the policy rationale there for that. A couple of the other provisions would allow the other health licensing boards only when they have received a specific complaint that alleges that one of their licensees is themselves abusing drugs or is grossly and inappropriately prescribing the drug. Only when they get a complaint like that would they be able to come to my staff. They would not have direct access to the database. They would come to my staff, present evidence that they have this complaint, and we would run a query for them so they could either substantiate the complaint or, quite frankly, exonerate the individual. Because of the way that this legislation was initially drafted 10 years ago, the Board of Pharmacy is the only board that currently has that authority. And yet in the 10 years we've had that authority, we've actually only used the PMP to investigate less than a dozen complaints. In over half of those cases, we actually exonerated the licensee and found that they were not abusing any controlled substances. One of the other provisions, actually that was amended out in the House, but it is still going forward in the Senate, was a result of the study that we were asked to do last year. When we came and talked to legislators over the last 2 years in the House, in the Senate, Democrat and Republican, we heard very loud and clear from very many legislators that they thought there ought to be required use of the PMP, by which they meant every time a prescriber or a pharmacist was going to prescribe or dispense a drug, he or she should have to go into the database and look up that patient. We thought that that was unnecessary, and that gets to the worry that I've had about a chilling effect on appropriate prescribing. So we did ask the legislature if we could please study it and come back with alternatives. Our alternative was, instead of requiring use, to require registration. So, and we can actually, and have already been working with other health licensing boards. There's no required registration now, but there is optional registration. And so we've already worked with the other health licensing boards to build the ability for people to register, for physicians and other practitioners to register right into their license renewal process. So they don't even really have to take that much time out of their day to actually get a user account. And so this idea that you would require registration was our answer back to the legislators who thought there ought to be required use. The only other thing I think here that really has a data practices implication, I will admit that it's somewhat rarer for us to get comments directly from the general public, but any one of us can come to the Board of Pharmacy if we think that there's data in the database. We do verify you are who you say you are, and you can get a report of any data that we have for you. When those people come into the office, they do give us comments, so we do get some public input. And one of the things that current law prohibits us from doing is if they ask us who's looked at my data, we can't tell them who's looked at their data. And so one of these, actually, I hope you would agree, would help the public whose data is in this database find out who is accessing their data. So I believe that those are the pieces of the bill that are under the jurisdiction of the committee here.
And before we move to member comments, we do need to approve both the A1 and A2 amendments. Representative Baker, can you speak briefly to the A1? I think what we covered actually was the A2, where we struck the consent language, or reinstated it, actually. The A1, you can
Madam Chair, I don't have a copy of the A1. I'm sorry.
It's all right. We will make sure you get one.
This is the Senate. Okay, now, Madam Chair, A1, I guess, is language, I think, that was already approved in the Senate side, according to Dr. Weiberg. Only permissible users, actually, well, it just explains it there. So I guess I do add it as a friendly amendment to the bill to get it to the way I'd like to have it.
And before we approve both amendments, I just want folks to know that the A2, didn't make the 24-hour rule, but I'm asking members if it's okay to waive that. Is there, do I have to vote on that? No? Is there any objection to allowing that? All right. Then the chair says that that's what we're going to do.
Thank you.
Let's go to the A1. All those in favor of adopting the A1, please signify by saying aye.
Aye.
Opposed, nay. The A1 is adopted. We're on to the A2, to House File 1652. All those in favor of approving the A2, please signify by saying aye.
Aye.
Opposed, same sign. Both amendments are on the bill. Again, Representative Baker, my concern here is that, again, this grand compromise was reached just a year ago, and it seems like the changes are being rolled back simply because some people didn't get what they want and they're taking another stab at it. And that's not the way I think we should operate around here. So with that, I would open it up to member discussion. Is there anyone that has a question on the bill? Representative Applebaum.
Thank you, Madam Chair. Members, this question is for either Dr. Weiberg or Representative Baker. I understand there were a controversial provision or controversial provisions that were discussed during this bill's last committee hearing in HHS reform a couple days ago. My question is, which issues raised controversy, and have the concerns been addressed by any means?
Representative Baker.
Thank you, Madam Chair, and Representative. I think that what was stricken, and again, the bill you're looking at here has my oral amendment already corrected in this, and that was requiring doctors, prescribers, to create a login into the PMP program. That gave them until the end of this year or maybe the beginning of next year or something. It required that all prescribers had at least to have a user account and a login on the PMP program. It did not require them to use it. It required them, though, to have a login. I decided after listening to people that that was controversial. I didn't think that they needed it yet at this point. It didn't make that big of a deal. So I removed that as to hearing Representative Liebling and I had conference afterwards, and I think I listened to people. And that's what I'm kind of learning as I go through this process, is that bills are meant to go through these processes like this to make them better. And I think to make them stronger and protect people and do the outcomes we want. So that specifically, Representative Applebaum, that's what happened in that case, is I removed that with an oral amendment to not require docs to log in and create an account.
Thank you, Representative Baker. Representative Applebaum, did you have any further questions?
One further question, Madam
Go ahead.
Chair, and again, this can be for either Dr. Weiberg or Representative Baker. As far as the amendments that were just adopted, do those in any way address the concerns expressed during the last committee hearing?
And before you answer that, I know Representative Liebling raised several concerns, and so if you would want to address some of those, that would be great, either you or Mr. Weiberg. Go ahead.
Yep.
Mr. Weiberg.
Madam Chair, Representative, basically, one of the amendments today, the A2 amendment, did address some of her concerns, and those were concerns for allowing prescribers and pharmacists to look at the data in non-emergency situations, non-dispensing, non-prescribing situations without consent. And so it addressed that. There was, and I'm afraid, sorry, but when I did the summary of the bill, I did forget one other very important data practices piece that is also controversial, and that Representative Liebling has had concerns about. One of the really appropriate criticisms that we have had for this program is that we haven't evaluated it. But up until last year, up until the last session, even though this program's been in place for 10 years, we've never been allowed to keep more than 1 year's of data in the database. And it's simply not possible to do a trend analysis and to do an evaluation with only 1 year's worth of data. So last year, we went to went through this process. We asked the legislature if for internal purposes only, my staff could have access to identifiable data for a 4-year period of time so we could do a trend analysis. Anyone else, any prescribers, any pharmacists, would only still have access to 1 year's worth of data, but internally we wanted identifiable data for 4 years so we could do our studies. We agreed to the compromise last year, and then we went back to our vendor, who we'd already talked about. We went back to him one more time, and we asked again, are you sure there is no way that if the data is de-identified after those first 2 years, are you sure there's no way that we can't do the sort of analysis we need to do? And the vendor told us, no, we can't. And one of the reasons is because there is no unique ID in our system that identifies a particular person. We don't collect, and we certainly do not want to collect Social Security numbers, which means in order to identify people, we need to know the name, the address, and the birth date at least, so we can try to find out if this John Johnson, who's born on this date in 1962, is the same person as we're trying to do the data. And so we did come back and ask again if we could have that data for our internal use on an identifiable basis. And that issue has not yet been addressed with the amendments.
Madam Chair, that's still part of this bill, and I think that's an important part of this bill because we want to know, we need more than 2 years of data on who someone is. This bill still identifies, we're asking for 2 more years, so up to 4 years of identifiable information so that we actually know if this program works or not. Right now, it's hard to say, and I think that's why this is an important part of this, and I don't want to water the bill down any more than I've already done. And I think that we've come a long ways, and I'm hoping that we can convince the committee that this program is worthy of taking some good, small steps forward to ensure that we can get the best information possible on the PMP program. And I just didn't want to also forget that we have someone from the DHS who may want to make a brief comment, Madam Chair, if that's okay, before we go to any further questions, if that's all right.
Before we do that, Representative Baker, Mr. Weiberg, on page 4, it looks to me like you're expanding who this data can be shared with. And that too is troubling, excuse me, to me. Especially since it's identifiable data. But if there's someone, I don't know if you want to address that and why that would be necessary to
Madam Chair?
expand who this data is shared with.
Sorry. Would that be lines 4.15?
Yes.
Okay, so one of the things that has been suggested to us, and this is one of the issues I believe that DHS is going to want to speak to, is that language refers to the ability of the other health licensing boards, the boards that license prescribers, to be able to request data from our PMP program. They won't have direct access. We don't want them going on fishing expeditions. But if they get a bona fide complaint alleging that a specific physician or nurse practitioner or something like that is themselves doctor shopping or themselves consuming drugs in a way that could be dangerous to their patients, they would be able to bring that complaint to us, and we would be able to give them that data. The current way that they would have to do that is if that person did not want to give consent or did not want to cooperate. Let's say the allegation was that the nursing board was investigating a nurse who was supposed to be doctor shopping. They would have to ask that nurse, what pharmacies have you gone to? If the nurse lied to the board and would not sign a consent, they'd have no idea the pharmacies that nurse went to. And they really could not investigate it. It's been suggested by others that they just subpoena the data. You can't issue a subpoena if you don't know who to issue the subpoena to. So that's really what that language is about. It's really it's not wide open. They would have to have a specific complaint. The other type of complaint, and this is what I think DHS would like to speak to, and they have a lot more information than I do because of the work they do, is if, for example, the Board of Medical Practice would get a complaint from maybe DHS that in their review of Medicaid and MHCP data, it looked like this prescriber was very inappropriately prescribing. And they sent that complaint to the Board of Medical Practice. The Board of Medical Practice then, with that complaint, could come to us and get data. And the reason that that's important is DHS, and I used to be the DHS pharmacy program manager before I moved into this role, only has data for the claims that they pay. They have nothing about cash data. And many people who are addicted to prescription drugs learn very quickly not to have their insurance pay for it. They pay cash. And they have no access to that data. Well, they do now because they have access to the PMP data. But ironically, if they look at that data, all they can give to DHS is their own claims data. Because of the way it's written, they can't give the PMP data to, say, the Board of Medical Practice. So that's what that piece is about.
Thank you. Before we go to, we have a couple member questions before we go to the other testifier. Representative Pinto.
Thank you, Madam Chair. So a couple things. One is, Representative Baker, you talked about the data retention period and being 48 months, and I'm looking at 3.15. Had you intended to have that line then say data retained beyond 48 months must be de-identified, or is there another place, the 48 months? I don't see that reference to the time limit anywhere else in the bill. I'm just trying to understand that.
Representative Baker.
You want to address that? I think it was a 2-year window, right?
Actually, I believe.
Madam Chair, I'm going to have Dr. Weiberg respond to that for me.
Dr. Weiberg.
I'm actually having my PMP manager come down here. This only contains part of this section. I believe there's another portion of the law that might not be recreated in here that already says we can only keep it for 48 months. Oh, I'm sorry, it is in here. I'm sorry, it is in here. It's on line 3.16. It says, "The board shall not retain data reported under subdivision 4 for a period longer than 4 years from the date the data was received."
Thank you, Representative Pinto.
Thank you, Madam Chair. Okay, and then another question on page 4, line 4.9. I'm wondering, there's a word, this is going to seem technical, but I think it makes a big difference. There's the word "or" in line 4.9, and I'm wondering, is that word "or," is that a typo, or is that word supposed to be there? And if the word is supposed to be there, then we've got a pretty massive broadening of access for licensed pharmacists. I'm wondering if the word "or" is not supposed to be there. If it, well, I'll let you answer that first, and then I will go on.
Wyberg?
Yep. Madam Chair, Representative, the "or" is supposed to be there, but if you take a look at the language on the other side of "or," it says, "or when consulted by a prescriber who is requesting data in accordance with Clause 1." This is sort of a technical thing. Right now, one of the first changes we made because we do try to be responsive to the users of the system as well. The original version of this law did not allow prescribers to have delegate accounts. And we immediately heard from prescribers, why can't my nurse look this up for me while I'm actually seeing patients? And so if you go back to what a prescriber can do, a prescriber or a delegate, it says agent or employee of the prescriber, we call those delegates, can look at data for those specific things. And so in essence, this extends that delegation to pharmacists. They can only look at the data when the physician asks them to look at that. We didn't really want pharmacists who in their own right can sign up to have user accounts to also be having delegate accounts as well.
Representative Pinto.
Hey, Madam Chair, but I think in that case, the "or" has to go, because the way this is written is the licensed pharmacist gets it when it's necessary or when consulted by a prescriber who's requesting data. So the concern I have, I think what you just said means the "or" needs to be taken out, because if the "or" is in there, now you've got a situation, look at the stricken out language, where it's when access is necessary beyond the extent to which the information relates specifically to a current patient for which the pharmacist is providing pharmaceutical care. I don't know if members of the committee understand what I'm saying, but I think that word, what you've just said, I think the word "or" would have to be taken out, because if it's in, those are two different ways pharmacists get access. One is consulting with physicians, and the other one is if it's quote-unquote necessary. And that makes me uncomfortable now that we're going beyond situations where you've got a current patient, pharmaceutical care, and the patient consenting to access.
Mr. Wyberg, or Dr. Wyberg, I'm sorry.
Let me take one more look at this.
What's your take now?
Madam Chair, Representative, I think what the
Mr. Wyberg.
what the purpose here is pharmacists, again, in their own right, can look at data. Pharmacists actually do, I hope you're aware of this, do way more than dispensing these days. There are many pharmacists that are called clinical pharmacists. I used to be one myself that never actually dispense drugs. They are actually out working on the floor in a hospital or within a clinic. There are pharmacists permanently stationed in emergency rooms who are never dispensing, and they're providing what we call pharmaceutical care, which are clinical services. And so I think what the language does, it says when a pharmacist is doing that in their own right, and I think we put the consent language back in, and with the consent of the patient, when they're doing that as part of their own practice, they can do that, or they can do it when they're consulted by a prescriber.
Madam,
Pinto.
yeah, I think I may have figured it out. I think, Dr. Weiberg, 4.7 to 4.9 is still out, and so I think what you're describing would require to put 4.7 to 4.9, that stricken language, back in. And I think if that were, I guess I should consult Mr. Gehring, but I think.
I'm sorry, I thought that was stricken or put back in.
Yeah, so I don't believe that the prior amendments added that language back in, 4.7 to 4.9. I'll look to Mr. Gehring, I guess, for guidance on all this.
Mr. Gehring.
Madam Chair and members, that's correct. So the A2 amendment only reinstated the stricken language on the bottom of page 3. It doesn't reinstate the language on 4.7 to 4.9. So if the intent of the bill is to reinstate that language, then an additional amendment would be needed.
Okay. So an additional amendment would be needed to,
So Madam Chair, the amendment would be on lines 4.7 to 4.9, reinstate the stricken language.
And I would make that motion, Madam Chair.
Thank you, Representative Pinto. Any comments on that change? All those in favor of Representative Baker?
Aye. No,
Okay. I thought you were looking like you wanted to say something.
no, I'm sorry, no, I'm fine.
Okay, so all those in favor of reinstating the stricken language on 4.7 through 4.9, please signify by saying aye. Aye. Opposed, same sign. That language is reinstated. Representative Hoppe.
Thank you, Madam Chair. I don't remember what the original motion was. What's the path for this bill? If we pass it, where does it go?
It does go to Health and Human Services Finance Committee.
So I assume that this has got more work yet to be done on it, and Representative Baker, that you can work with the proponents and opponents to get this thing in the shape that I think we'd all like to see it in. Thank you, Madam Chair.
Right, thank you, Representative Hoppe. Representative Pinto?
Thank you, Madam Chair. So just one final question, which is what DHS does have to say about the bill. Thank you.
Who's here? Let's hear from the. Thank you. Thank you for being here. Go ahead and state your name for the record and proceed.
Madam Chair and members of the committee, I'm Vicki Kunerth. I'm from the Department of Human Services, and within that agency, I'm coming from the Office of Inspector General, and I'm responsible for fraud investigations. I'm here in support of this bill, and in your packet, I think you received a letter from our commissioner. I'm going to just speak to particularly one point. In my division, we operate the Minnesota Restricted Recipient Program, where we closely manage care for about 4,000 public clients who had very serious and dangerous patterns of misuse of health care services. The large majority of this misuse is drug-seeking behavior, often through emergency rooms or going to multiple prescribers for similar controlled substances. We have been given very limited but specific access to the PMP to get a much more complete picture of all the pharmacists, all the prescribers, and all the drugs these public clients are using. And from that, we can select who to place in this program and to manage it. As Dr. Weiberg mentioned, our DHS billing system has just the drugs we've paid for. And as he said, clients often start to pay cash to keep below our radar. We were just called this week by a pharmacist who reported a public client. The pharmacist was in North Dakota, reported a public in Minnesota client that filled 50 controlled substance prescription in a very short period of time for cash. That data is in the PMP, but it would never come to our attention. When we are dealing with these clients that have misused services, particularly prescription drugs, sometimes it comes to our attention that there's a prescriber that gives us great concern, either how they're prescribing or the volume or whatever. And as Dr. Weiberg said, at that point, we review only our own department data of the billing and seeing if there's any patterns of concern. That's a limited picture, but even from that, we take the information, package it up of our own billing information, and send it to the health licensing board that's appropriate, the nursing board or the medical practices board. They then request data on the PNP to get a much more complete picture of all the prescribing, as well as reviewing medical records and everything else. And with that, they can take action against a prescriber that is part of the abuse of selling or using public clients to sell prescription drugs. So this whole project makes our program much more effective, and we really appreciate it as an important resource.
Thank you, Ms. Cooner. Appreciate your testimony. Is there anyone else in the audience wishing to testify for or against this bill? Welcome to the committee. Please state your name for the record, and please keep your testimony pointed to this as pointed as possible. Thank you.
Thank you, Madam Chair, members of the committee. My name is Twyla Berets. I'm president of Citizens Council for Health Freedom.
and we have been in opposition to this program, this monitoring program, since the very beginning. One of my concerns about moving this bill forward in this committee would be that we haven't really managed to take anything out in the Senate side, and therefore I have some concern that even with the good things that have been taken out through this committee, that will all just be put back in. And so I'll tell you that when I look at this bill, I look at mission creep. So we were here at the very beginning when it was said that this would never be used for law enforcement, never be used to look, never be used for research. It was only going to be used for a practitioner to look into the system and see whether or not they should prescribe these drugs for their own patients. And now we're going to, the intent here in this bill is to be able to essentially do research on people for 4 years. Longer if they maintain themselves in the system longer. A lot of people are in this system. I believe that I heard the number was something like 1.8 million people, and there's something like 6 or 7 million prescriptions that are in here. And so they would be able to be used for research during that 4-year period of time, and there would be assessments and assumptions made because I think it was Mr. Weiberg who said something like, well, we would be able to see if it works. Well, what would you compare that to see or know whether it works? And so I'm not sure where that goes with that research. And then we just look at it as, being used now for fighting crime. So the part where it says on page 3.8, where it has crossed out or substantiate, this was never going to be allowed to substantiate, but now it would be. And when it says on page 4.19 that they would be looking for what would constitute a crime, and this is what they told us would never be done. And so, as I said, this is mission creep. I will say that it's always possible to find a story that would be used to move for expanding government in surveillance purposes to help someone, but we can just imagine how far a government could be expanded on the basis of we can help save someone or we can help somebody help themselves. So we also notice that there's no search warrant or court order for this substantiation for looking into this data. And so we're opposed to all of the sections that we're happy with the amendments, but we're concerned that if this moves forward, it's all just going to come back in. And I'm not sure who's going to prevent it from coming back in. So that's our concerns, Madam Chair. We're opposed to the bill, and we would prefer not to see it not go further. Thank you.
Ms. Brace. Any other members of the audience this evening that would like to testify in this bill? Please come forward, and if you could make your testimony brief, that would be very appreciated. Thank you.
Absolutely, thank you. My name is Molly Ekstrand. I'm a pharmacist and leader of the medication management program at Park Nicollet, and I just found out 10 minutes ago when I arrived that the language was retracted, so I apologize, but I drove down here tonight because I do feel really passionately about this. So we have clinical pharmacists working in primary care teams within Park Nicollet, and we are being very proactive in wanting to identify our patients that are using opioids regularly. As we know, opiate use is a public health problem and an epidemic, not only in our state, but nationally. And we are seeking to proactively identify our patients to help them seek out different pain management strategies and to help them taper off of these potentially dangerous medications. So we are pharmacists working in this capacity for the patients in our entire healthcare system and seeking to do this. I want the committee to really understand that as a licensed healthcare provider, I take an oath to protect patient privacy. I am not going to use this patient information for anything other than the best care and the best intent that the patient deserves. Every health system in Minnesota and every healthcare professional takes a significant oath to protect our patients' health records. So thank you for the opportunity to testify. I would really, really like the opportunity to be able to access the PMP to help our patients be safe and get off of some of these medicines. And the reality is that some patients don't know what they don't know. and they are really at danger of an adverse drug event. And I want to do everything that I can in a pharmacist capacity to help our patients.
Thank you so much. Thank you for making the trip down here to the committee. Appreciate your testimony. Any other member questions? Seeing none.
May I make a closing
Yes,
statement,
you
Madam Chair?
may, Representative Baker. So sorry. Go ahead.
No, that's okay. Because I know this is not an easy decision. And I really appreciate the ability to present this to the committee. The bill is not perfect, and I will keep working on this if you're allowing me to take it forward. I think that we've stricken out some very important parts of this that make it more palatable. It is important, and it's important to me, but I believe in the program. I know I'm a freshman, and I probably walked into a kind of a nest here, but I'm loving it because it makes it a better program, and it's still very personal to me. And I want this to have the light of day to make sure that we can, very small steps, make this a better program going forward. And again, I would wholeheartedly appreciate the support to let it go to the next step. Let's keep working this through. I appreciate the amendment already offered up that we will be happy to do that. So I do hope that we get the support of the committee, and thank you, Madam Chair.
Thank you, Representative Baker. My real tendency here is to lay this over. Representative Baker, I will be working with you very closely on this language as it moves forward. I don't like this bill, I have to tell you, because of the reasons that we've talked about this evening and that were talked about in the previous committee. I would also like to hear your guarantee that if we don't reach consensus, that this bill won't go any further.
I have that. You have my support on that,
All right.
Madam Chair.
With that, I will renew my motion that House File 1652 be re-referred to the Committee on Health and Human Services Finance. All those in favor, please signify by saying aye. Aye. Opposed, no. The bill is on its way.
Thank you very much. Thank
For
you.
your time. Representative Peterson, 1614. For what? 1640, sorry. Welcome to the committee.
Thank you, Madam Chair.
And I don't see any amendments in the packet, is that right?
That is correct.
All right. I will move House File 1640 and recommend that it be re-referred to Health and Human Services Finance Committee. Go ahead with your bill, Representative Peterson.
Thank you, Madam Chair. And I just want to request, I guess, which purview of the bill, which part of the bill is in your purview so we can address that.
Certainly, if House Research would like to help us out with that, would be perfect.
Sure. Madam Chair and Representatives, this bill makes conforming changes with the other parts of the law to the civil actions portion of the bill, which is Section 5. And this allows the county attorney to, or the state to go after somebody for reimbursement. And so it's just changing the language in that part of the bill to conform with the other changes.
All right.
Oh, and there's also data provisions in Section 1.
So Section 1, there's some data provisions.
I think, again, though, those are conforming changes related to the language as it's been changed throughout the bill.
All right, thank you. Representative Peterson, if you want to go ahead based on those comments, that'd be great.
Thank you, Madam Chair and members. Basically, this bill is related to disability parent fees and eliminating those parent fees. And so I think some of this information relates to how it may no longer be relevant to provide that information because they're no longer paying the fee to a certain degree. And as far as the civil actions go, provide evidence of the child's health care coverage, including medical assistance. And it sounds like so that the language is consistent with the law. is really how the changes are important.
Thank you. Do you have a testifier that wishes to address these areas of the bill?
I do have Steve Larson here with ARC Minnesota that, has been very involved with disability components, and I don't know if you'd like to add anything to that, Mr. Larson.
Mr. Larson, welcome to the committee. If you could state your name for the record and continue.
Madam Chair, I'm Steve Larson with the ARC Minnesota, and I think Representative Peterson described the purpose of the bill, and so if the council has further questions that we can address, but we were just trying to conform with the elimination of fees to make it consistent.
Are there any committee questions? Seeing none, is there anyone in the audience that wishes to testify on this bill? Seeing no one coming forward, I will renew my motion that House File 1640 be re-referred to the Committee on Health and Human Services Finance. All those in favor, please signify by saying aye. Aye. Opposed, nay. The motion is approved. House File 1640 is on its way to Health and Human Services Finance.
Thank you, Madam Chair and members.
Thank you. Okay, we have an Atkins bill that's going to be presented by Representative Hoppe.
Thank you, Madam Chair and members. I will move House File 1167.
And this House file will be re-referred to Transportation.
Thank you, Madam Chair and members. Briefly, this is to allow deputy registrars, the people that do the driver's license, that give us our driver's licenses, to allow them to move to electronic storage so they don't have so much paper around.
Sounds like a good bill. Do you have a testifier there that has planned to testify or just here to answer questions?
He's here to answer any needed questions.
All right. Do members have any questions for the bill's co-author or the testifier? I am assuming that you'll be applying the same data privacy provisions to the electronic versions as you were applying to the paper versions. Is that correct?
Madam Chair and committee members, for the record, Jim Hurst on behalf of the Minnesota Deputy Registrars Association. That is correct, and we are regulated by the Department of Public Safety, and the language directs the department to create those standards for us, which we would abide
Thank
by.
you very much. Any member questions? Seeing none, anyone in the audience wishing to testify for or against this bill? Seeing none, Representative Hoppe would like to renew his motion that House File 1167 be re-referred to the Committee on Transportation. All those in favor, please signify by saying aye. Aye. Opposed, nay. The bill is the bill is on its way to Transportation Committee. Thank you, Representative Hoppe.
Thank you, Madam Chair and members.
Okay, Representative O'Driscoll is on his way. Members, you can get out of your packets House File 953. Is there anyone in this, oh, there's Representative O'Driscoll now. Welcome to the committee, Representative O'Driscoll. Thanks for rushing down here.
I was actually up, but I thank you anyhow.
I will move House File 953, recommend that it be re-referred to the General Register. Do you have amendments, Representative O'Driscoll?
Thank you, Madam Chair, and members of the committee for the opportunity to be here this evening with you. I do have a DE3 amendment, and I would ask to move that to get the bill in the shape that I need. Thank you.
All right, let's dig through and try to find. Okay. All right, we have the DE3 in front of us. Any discussion on the DE3? Seeing none, all those in favor of adopting the DE3 to get it in the shape that the author wishes, please signify by saying aye. Aye. Opposed, same sign. Representative O'Driscoll, the DE3 is before us. Or the bill is now, as amended. If you want to tell us about your bill, would you like well, this is a foreclosure bill. Ask House Research. It looks like there's really only couple simple changes. Representative Driscoll, go ahead and explain what you've got.
Thank you, Madam Chair. You're correct. It's a rather straightforward bill. What it does is it provides clarification on the process of publishing notification of mortgage foreclosures by advertisement here in the state of Minnesota. Currently, what we have are 87 counties. Most of them have newspapers that are domiciled within that county. So lenders who find themselves with the need to do a mortgage foreclosure could utilize that paper. However, sometimes that paper may not have distribution in parts of the county that affect that county, and there may be a municipality or a region that newspaper serves that spills over into a separate county. And I'll use where I live as an example. The St. Cloud Times is the newspaper that covers quite a bit of the central Minnesota area, where the city of St. Cloud comes together, the three different counties, Sherburne, Stearns, and Benton counties. Because the St. Cloud Times is domiciled in Stearns County, we would also, under this law, be able to provide clarification and assurance to a lender that if they were to use the St. Cloud Times in Benton County or in Sherburne County for properties that are within the city of St. Cloud or that market, that there wouldn't be any issues relating to having made a proper publication. Another example might be that up in Little Falls, the Morrison County Record, located in the county of Morrison, also services another part of my district on a regular basis with the newspaper, the Holdingford and Royalton Rice area. Again, Royalton being Morrison County where it's domiciled, Benton County where they have distribution, as well as Stearns County where they have distribution, but not for the entire county. All what this bill does is it clarifies that a newspaper would have the ability to do just what I'm talking about. And a lender would have the ability to do just what I was talking about, is publish in that newspaper that would have circulation within a neighboring county, even though they're not domiciled, and that's where that property may be located. This is a collaborative effort between the Minnesota Bar Association, the Minnesota Bankers Association, Legal Aid, and the Newspapers Association. And Madam Chair, I am not aware of any opposition. The DE3 provided final clarification for all of the above parties that I just mentioned. I'm ready to answer questions if members have them.
Thank you. Are there any member questions? Seeing none, is there anyone in the audience that wishes to testify for or against this bill? I see the newspaper folks are here smiling, so they must be okay with this.
Madam Chair, my understanding is they are available if need be, but they don't have a desire to testify.
Very good. Seeing no member questions and no one else from the audience that wishes to testify, I will renew my motion that House File 953 be re-referred to the General Register as amended. All those in favor, please signify by saying aye. Aye. Opposed, same sign. You're on your way.
Thank you, Madam Chair and members.
Thank you, Representative O'Driscoll. The next bill is Representative Loon, House File 328. Welcome to the committee, Representative Loon.
Thank you, Madam Chair.
And I don't see any amendments in the packet. Are there any?
Yeah, I think the page is passing it out.
Oh,
Should be one amendment.
All right. I will move House File 328 before the committee and recommend that be referred to the Job Growth Energy Affordability Committee. And we will first look at the A1. The A1 is before us. Do you have any comments on the A1, Representative Loon?
Well, just briefly, Madam Chair, and some of you have heard this already in Commerce or Government Ops, but the bill overall is referred to as a MinVest bill. What it would allow crowdfunding as an option, so small businesses could raise funds through the internet and obtain an equity share. And with me is Tom Loonan with Winthrop and Weinstein. Some young attorneys from that firm have been working hard on this bill, and through a number of conversations with the Commerce Department, which would oversee this program, have suggested some changes that they would like to ensure that the portal operator, the people putting out the website for people to look at and decide if they may want to make an investment, that data provided would be privacy protections for that. So that is the purpose of the amendment.
Thank you, Representative Loon. Are there any comments or questions on the amendment? Seeing none, we will, all those in favor of adopting the A1 onto House File 328, please signify by saying aye. Aye. Opposed, same sign. The A1 has been added. Any member questions about Representative Gruenhagen?
Well, just real quick, thank you, Madam Chair. Yeah, like there's different sites where you can go and raise money with this, you know, for a project that you have, whether it's individual or business, and on the website. So this would do what?
Representative Loon.
It would
Thank you.
control that information?
Thank you, Madam Chair and Representative Gruenhagen. You know, for any really technical questions, I'll refer to Mr. Loonan. But basically, right now, under securities law, you cannot raise money over the internet. You know, there is crowdfunding that exists where you can basically make a contribution, maybe receive a CD or a T-shirt, but it's not sort of a formal investment in the sense one would think. So this legislation would authorize that for Minnesota companies and only for Minnesota investors.
Representative Gruenhagen?
Oh, yeah, that answers my securities. You know, okay, that clarifies it. Thank you.
Thank you.
Any other member questions? Representative Pinto.
Thank you, Madam Chair. So Representative Loon, at this point, is the Department of Commerce supportive of it with those changes? Do you know what their thoughts are?
Representative Loon.
Thank you, Madam Chair, Representative Pinto. Discussions are ongoing. I think we have basically resolved all of the issues with perhaps a couple of, and that is the level of investment that would be allowed. And I expect that those discussions will be ongoing and probably subject to some discussions before the Jobs Committee as well. I don't know if Mr. Loonan wanted to comment on that.
Yes, thank you, Madam Chair.
Loonan, go ahead and introduce yourself for the tape, please.
Yes, my name is Thomas Loonan. I've been working with the attorneys at Winthrop and Weinstein to put this legislation together for the past 5 months. And recently we've had a lot of conversation with the Department of Commerce, and it is our understanding that the amendments that we have now put into the bill, the Department of Commerce is no longer opposing the bill and will allow it a clear path to be passed. So we don't anticipate them to give any more opposition to the bill, and we think that the amendments that are being put into place now will make it a workable bill for the department.
Thank you, Mr. Loonan. Representative Gruenhagen, another question?
Thank you, Madam Chair. Just so if I'm an investor in this, what guarantees that I have that it's not a scam? Is there approval process to be able to put it out onto the internet, or you know, how does that work?
Oh, Mr. Loonan.
Yeah, thank you, Madam Chair. Representative, there is a process in place now where what happens is the portals will have to register through the Department of Commerce. The business themselves will have to show that they are a legitimate business, and then the businesses must provide certain disclosures that are to be published on the website. These include the business plan, financials of the business, and just we put as many protections in place to allow the consumer to be aware that the business they're investing in is a legitimate business.
Representative Gruenhagen.
Oh, thank you, Madam Chair. So who vets that information? Is that the department?
For the business themselves, it's, excuse me, Madam Chair, the business themselves, it's the portal operators have the job of vetting to ensure that all the information that the businesses provide and that the business is providing to the consumers is legitimate information.
Representative Gruenhagen.
Just a follow-up question. Thank you for those responses. Then who's liable if the information is not correct? The portal advisors, or?
Yes,
Mr.
Madam
Loonan?
Chair, Representative, if the portal operators, if it's their mistake and they did not do the proper vetting of the businesses, then it would be the portal operators that would be liable, and they could face penalties for that.
Representative Gruenhagen.
Yeah, and in the interest of time, I'd really check that, you know, just don't want people being scammed off by small business operations getting on there and not a proper vetting process. Now, if you believe there's enough guarantees, but that's the one thing I just recommend to the author, because we got a lot of security scams going on out there, and nothing against small. I'm a small business, okay, and I'd love to raise money. If you want to invest in me tonight, I'd be willing to take a look. But the thing is, you know, the type of information that's put out there and how accurate it is, there's got to be some checks and balances on that, and some consequences to the people that allow it on the internet if it's not accurate.
Representative
And
Loon.
there's plenty of scams out there, but
Yeah,
anyway, I'll let it go at that.
Thank you, Madam Chair. Well, and Representative Gruenhagen, I think you're absolutely right. And like I said, this legislation has been the subject of long negotiations and discussions with the Department of Commerce. I myself sat down with the commissioner, and we both agreed that consumer protection had to be a #1 goal in putting this idea forward, so.
Okay.
Representative Vogel.
Thank you, Madam Chair. And just comment on that. It does appear that it has to be operated by a registered broker-dealer, so, right, the website? It
One of
doesn't.
either one of you, Mr.
Madam
Loon?
Chair, Representative, that is not entirely correct. The portal operators themselves may register through the Commerce Department. They pay a fee to run the website and ensure that they can set it up. And if they go through the proper process with the department, they do not need to be a registered broker-dealer. However, broker-dealers themselves do have the ability to set up these crowdfunding websites if they so please.
Representative Vogel?
Okay, so just follow up. So there doesn't necessarily have to be a registered broker-dealer involved in this transaction. It could be just offered by anybody as long as they're following the bill itself.
Representative Loonan, or Mr. Loonan.
Thank you, Madam Chair. Representative, that is correct. And the reason for that being is simply this is an option for small and growing businesses. And to bring a broker-dealer into it is going to be a very expensive process for these businesses, and it would not necessarily meet the purposes that this bill is trying to solve.
Follow up? No. Representative Gruenhagen again.
Oh, thank you, Madam Chair. Yeah, so who vets the portal advisor if it's not a broker-dealer? Who vets them, and do they carry a bond, or what? I mean, how do they stand behind if the information they put out there is not accurate? I mean, you can have them liable, but then you can set up shell corporations to try to get out of that, and all of a sudden there's nothing there. I mean, is there a good vetting process in terms of who's allowed to put this information out there?
Mr. Loonan?
Thank you, Madam Chair. Representative, I believe the question that you're asking, the process goes that what we're putting into place here today with the with the Minvest legislation is going to be a much stronger bill than what could currently happen. Currently, you could have a company that could go out and solicit funds and basically partake in the type of fraud that you initially raised as a concern.
Mm-hmm.
And what this allows, it allows the Department of Commerce to have direct oversight over these websites which are offering it. And all those involved in the process, the businesses and the portal operators themselves will be responsible to ensure that these are good deals. Now, as far as a bond, there is no requirement in the bill right now. There is a possibility of the administration, the Department of Commerce to promulgate further rules if they so please. And if it starts to become an issue, that may be something that the commissioner wishes to take up, in which case that issue will be addressed.
Representative Gruenhagen?
Yeah, I like the bill. I like, obviously it's another way for small businesses to raise funds, but I just, in the interest of time, I'll leave it at that. I just urge the author to make sure there's proper safeguards and money available if there's scams or false information put out there. Got enough problem with that the way it is. And, but I like the idea. It just, the safeguards is probably where I come down on a little bit.
Okay.
As far as if there's enough safeguards to protect the investors out there. Thank you, ma'am.
Thank you. Mr. Luna, I had a question on the amendment that talks about either written or electronic consent. So will this be like you see on many websites where you click the little box if you agree to the terms? Or exactly what, this is kind of general in its context. I'm just wondering how you envision that, or if it's articulated elsewhere.
Thank you, Madam Chair. The purpose of doing it through electronic is all the transactions are going to take place through the internet, and through that the purchasers must make certain affirmations, such as that they understand the risk of investing in a company, they understand that there's no guarantee, and also that they can afford to make these investments, that it's not going to bankrupt them. So I think we envision that the affirmation of disclosing data would likely be included with the other affirmations that the purchasers need to make.
Okay. Any other member questions? See none. Anyone in the audience that wishes to testify for or against this bill? See none. I will renew my motion that House File 328 as amended where'd my script go? Be re-referred to the Job Growth, Energy, and Energy Affordability Committee. All those in favor, please signify by saying aye. Aye. Opposed, nay. The bill is on its way. Thank you, Representative Loon and Mr. Loonan.
Thank you, Madam Chair, members.
Next up, Representative Smith.
Madam Chair, I move House File 1091.
I believe it's 1901.
That as well, yes, both bills, please.
Oh, we have two of them?
No, that was a joke,
Oh.
Madam Chair, I'm sorry.
I get it. Okay. This bill will be referred to the Committee on Taxes. Representative Smith, go ahead.
Madam Chair, members, House File 1091 is a bill endorsed by the Minnesota State Bar Association.
For the tape, that's 1901.
1901.
Go
Thank
ahead,
you.
Representative Smith.
My notes were wrong there, Madam Chair. And so it's endorsed by the Minnesota State Bar Association. It's a bill that changes the Minnesota estate tax to mirror the federal estate tax. This is specific for Q-tip trusts, which are qualified terminable interest property interest trusts. This is revenue neutral. This only affects who pays the tax, not how much tax is collected. I will stand for any questions.
All right, members, we're to the portion of the bills that we heard preliminarily this morning, so hopefully we can kind of breeze through these. Are there any questions on House File 1901? Anyone in the audience wishing to testify on House File 1901? Seeing none, Representative Smith will renew his motion that House File 1901 be re-referred to the Committee on Taxes. All those in favor, please signify by saying aye.
Aye.
Opposed, same sign. The bill is on its way to taxes. Thank you, Representative Smith.
Thank you,
Representative
Madam
Smith,
Chair.
1770 is next.
Yes, Madam Chair, I move House File 1770.
And 1770 will be re-referred to Public Safety and Crime Prevention. Go ahead, Representative Smith.
Madam Chair, there is an amendment to this titled A1. I move that amendment, ask for adoption.
All right.
To get the bill, there's one minor change on line 1.17. The number 11 is added.
Okay. I'm sorry, Representative Smith, could you restate the,
Yes, Madam Chair. House File number 1770A1 is the amendment.
right.
Line number 1.17, the number 11 is added. That is the only change to the amendment.
Okay, terrific. Any questions on the amendment? Seeing none, all those in favor of adopting the A1 amendment to File 1770, please signify by saying aye. Aye. Opposed,
Aye.
same sign. The A1 is adopted.
Thank you, Madam Chair. Members, House File 1770 is a bill that is friendly to the county governments for both outstate and metro. It allows counties' conciliation court to have the jurisdiction over claims owed to their own individual county. This is friendly to the county attorneys, and I ask for your support.
Thank you. Any member questions? Seeing none, anyone in the audience wishing to testify on this bill? Seeing no one, Representative Smith renews his motion that House File 1770 be re-referred to Public Safety and Crime Prevention as amended. All those in favor, please signify by saying aye.
Aye.
Opposed, same sign. The bill is on its way to Public Safety.
Thank you, Madam Chair.
Thank you, Representative Smith. The next file is House File 1342. Representative Smith.
Madam Chair, thank you. I move House File 1342.
Thank you, Representative Smith. Are there any amendments to this one?
There is not, Madam Chair.
Okay. This bill will be re-referred to the General Register. Representative Smith, if you could tell us what just give us another brief on what the bill is.
Thank you, Madam Chair. Members, House File 1342 makes a variety of technical changes that are recommended by the National Conference of Commissioners on Uniform State Laws. This bill has bipartisan support, and Mr. Bohl is here to give testimony.
Mr. Bowl, please introduce yourself for the tape and go ahead with your testimony.
Thank you, Madam Chair. My name is Phil Bowl. I'm a locally based attorney and a member of the Minnesota State Bar Association Bankruptcy Law Section. I chaired a working group that reviewed this bill on behalf of the bankruptcy section, and that working group came to a firm conclusion that this is an improvement on existing law and should be supported. I'm happy to answer any questions.
Right. So I'm assuming that all of this is. Are there any specific changes that you think the committee should take special note of?
Your Honor, excuse me.
Thank you.
Madam
Go
Chair.
ahead.
There are two changes that I would take note of. This amendment was originally developed by the Uniform Law Commission to deal with problems created by not having a uniform choice of law provision in the statute that it is amending. That is the Uniform Fraudulent Transfer Act. There was no choice of law amendment, and as a result, in transactions that were multi-state, the same transaction would be judged under various different laws possibly. That created a lot of litigation cost and a lot of uncertainty for transactions. And so this was the problem that initially started this amendment being developed.
Very good, thank you. Are there any member questions? Seeing none, anyone in the audience wishing to testify on House File 1342? Seeing none, Representative Smith renews his motion that House File 1342 be re-referred to the General Register. All those in favor, please signify by saying aye.
Aye.
Opposed, same sign. House File 1342 is on its way to the General Register. Okay.
A page just was dispatched to find Representative Zerwas. He is close by, and we expect him back momentarily.
Mr. Chair, didn't we hear these bills?
We did in an informational basis.
And we just wanted to see if there were, I mean, the committee heard them already, but we wanted to see if anybody else
Exactly, for public testimony, comment section, and then also officially voting. There is.
I mean, if you need a volunteer.
Would you?
I'm just saying, unless we wait a minute.
No, if a representative, if you'd like to, that would be fine.
I don't want to step on his toes.
No. Why don't we start?
Yeah, because we heard this.
Representative Grunhagen has very nicely decided to start this off until Representative Zerwas comes back.
Mr. Chair, I'll move the bill. I'm not sure where it's going from here.
House File 1604. I move that House File 1604 be re-referred to the Health and Human Services Finance Committee.
And, Mr. Chair, we discussed the auto injector authorization at committee earlier today, and I think the main purpose was to rehear it to see if there was anybody in the audience that wanted to testify for or against the bill.
Thank you. Before we get to that, there is an amendment titled A1. Do you move said amendment?
I'll move the A1 amendment.
Any discussion? With no discussion, all in favor of the A1 amendment signify by saying aye.
Aye.
Any opposed, say nay. The amendment carries. All right, on to the bill. Is there any testimony from the public? Seeing none, is there any additional discussion from the committee? Representative Pinto.
Thank you, Mr. Chair. I'm trying to remember, Mr. Chair, the question that Representative Hillstrom had regarding the Good Samaritan protections. I think she was, I don't know if anybody else in the committee remembers that, but she had something that she was wondering about relating to that. I think we were hoping to get an answer to later on. phone a friend, yeah.
Chair and representatives, the amendment, this A1 amendment to House File 1604 references the Good Samaritan law. And so it makes this action that's taken under the bill as far as using the auto injector pen, the same emergency care advice or assistance under the Good Samaritan law.
Representative Pinto?
Thank you. Thank you, Mr. Chair. Okay, I see. I understand how that's working then. Okay, that's helpful. Thank you.
All right. Thank you, Ms. Mullen. Any additional questions, discussion? If not, the motion is restated to have House File 1604 be re-referred to the Health and Human Services Finance Committee. All in favor say aye.
Aye.
All opposed, nay. The ayes have it. The House File 1604 passes and goes on to Health and Human Services Finance. On to House File 1163.
Mr. Chair, I'd like to move House File 1163.
All right, and I move that House File 1163 be re-referred to the General Register. Are there any testifiers? Welcome to the committee. Please state your name for the record.
Mr. Chairman, member of the committee, given the late hour that it is, my name is Tom Kelleher. I'm here representing the Minnesota School Bus Operators Association. This is a bill we've been working on since the beginning of session to speed up the background checks that are required to get a school bus endorsement attached to a commercial driver's license. I'd be happy to answer any questions. We've been through the Education Committee and the Transportation Committee, and now we're here before you.
Thank you, Mr. Kelleher, for being here this evening. Any questions? Representative Pinto.
Thank you, Mr. Chair. I understand that the DVS has testified previously with some concerns about the bill, and I wonder if the testifier can, I don't know if Representative Gruenhagen can help since filling in for Representative Zerwas. Maybe the testifier can.
Mr. Kelleher?
Mr. Chair, the department's here. I guess I'd rather have them characterize their own testimony. Leave it at that. But I'd be happy to answer any questions after they're done testifying.
Thank you.
Welcome to the committee. Please state your name for the record.
Thank you, Mr. Chair, members of the committee. My name is Deb Carlson. I'm with Driver and Vehicle Services. One of the major concerns we have with this bill is the length of time of 180 days given to a temporary license. That just seems to be a long time for someone that's just doing a BCA background check. Our typical time frame turnaround to do a background check for a BCA, where it goes from Driver and Vehicle Services to the BCA, averages somewhere around 7 to 10 days. The timeline to obtain a commercial driver's license with a school bus endorsement, once they're hired, they have to pass knowledge tests. They have to get which is up to 4 knowledge tests if the bus has air brakes. They have to get a medical exam. Then they have to apply for a commercial learner's permit and hold that commercial learner's permit for 14 days. So a best case scenario, a new driver could go through the system of getting licensed 18 to 20 days. If there's any other questions, I'm willing to answer any other questions.
Thank you, Ms. Carlson. Representative Pinto.
Thank you, Madam Chair. So I guess I want to understand, you're saying under current law, maybe 18 to 20 days, somebody could get a license, if I'm understanding you, but the concern here is that we don't know for that 180 days what kind of criminal record somebody has. I'm just trying to understand that.
Ms. Carlson.
Thank you, Madam Chair. The change from Mr. Sorry, Madam Chair, members of the committee. The question, okay, the 180 days, now could you please restate the question? I'm sorry, I lost myself.
With the chair's permission. Thank you, Madam Chair. I guess I was first trying to understand I understood you to be talking about current law versus this 180 days. And I guess maybe the first step is, can you just restate what you're describing about what happens under current law?
Under current process, a new driver would submit the request to do a BCA check. We encourage the industry to send that when they hire a driver. When we receive that, typically then we send it over to the BCA, and the turnaround time to get approval for a new driver would be 7 to 10 days.
Representative Pinto?
Thank you, Madam Chair. And so you're saying that under this bill, somebody could drive for up to 180 days, and maybe they have a criminal record, maybe they, we don't know that until the end of that, the expiration of that period? Is that what you're saying?
Correct.
Madam Chair?
Representative Pinto? Who said that? Go ahead.
Hi, Madam Chair, members of the committee, Representative Pinto, and maybe if I could just help a little bit. The bill was premised on the fact that there are a number of factors that our operators within our industry have identified as problems with getting a commercial driver's license with an S endorsement in a timely and speedy manner. If you look on page 2 of the bill itself, what we're trying to do is duplicate language that's on lines 2.7 to 2.14, where the temporary license may be issued by the commissioner for no more than 180 days. We did not think up 180 days out of the air. It was what was being currently utilized by the department for this type of temporary license for those people who come to Minnesota from outside the state who are non-Minnesota residents within the last 5 years. What we are proposing to do is to provide an opportunity to attest through an affidavit that under current law, if you look at lines 2.10, a criminal history check from each state of residence for the previous 5 years, the criminal history check may be conducted and prepared by any public or private source agreeable to the commissioner. We're not picking the sources, we just want to use a private source that's already approved by a list by the commissioner. So we're not trying to find Acme driving, background check company and not do a thorough check. We are attesting in an affidavit that we have shown that the driver has not had any disqualifying offenses, which are a whole litany of motor vehicle laws, DWIs within the last 5 years, domestic violence issues, so on and so forth. So we're not trying to change any of those sort of disqualifying offenses. In the fall, there were great delays in regards to getting a criminal background check through the department. That's what brought this bill forward. I've been told through the last committee hearing that the department is now turning these background checks around in a matter of days. We think that's terrific. However, we would still like this opportunity to utilize a private background check company as approved by the commissioner. And the commissioner still has the authority to may issue a temporary license up to 180 days, which is what the current law states for out-of-state, out-of-residence of Minnesota.
Representative Pinto.
Thank you, Mr. Chair. Changing back and forth here on me. I guess I'd like to ask the testifier from DVS to respond to that then about how these situations are in fact different, because it sounds like the testifier is saying that they're the same.
Ms. Carlson?
Mr. Chair, Representative Pinto, we did have delays in the fall. What's referenced with the 180 days that is being stricken and moved for this temporary, the way we understand the bill is that 180 days would apply to every new school bus driver. The 180 days that exist today, we allow that for a resident to Minnesota that has been a Minnesota resident less than 5 years. They hold a Minnesota driver's license, but they declare, and we know because in our records, they've come to Minnesota with a license from another state in the last 5 years. So then we require an FBI national check where prints are sent to the FBI. So because of that length of time to turn that around, that's the only time that currently we issue a temporary 180-day license.
Representative Pinto?
That's the delete, that's the re.
That's all, Mr. Chair. Thank you.
Any other questions or comments?
And Mr. Chair, I do request a roll call vote.
Representative Pinto requests a roll call vote. Before we get to that, Mr. Kelleher, Ms. Carlson, thank you for your testimony.
Thank you very much, Mr. Chair.
Mr. Chair and members, thank you to Representative Gruenhagen for filling in for me. It sounds like he did an excellent job, so I won't belabor the point. It's we want to treat in-state people exactly like we would treat out-of-state people. There would be a private background check approved by the commissioner, and the temporary 180-day license work permit is a may, not a shall.
Thank you, Representative Zerwas. And a roll call has been asked for. The clerk will take the roll.
Chair Scott. Representative Smith.
Yes.
Representative Applebaum. No. Representative Gruenhagen.
Yes.
Representative Hillstrom. Representative Hoppy. Representative Johnson. Representative Lesh. Representative Lomer.
Yes.
Representative Pinto.
No.
Representative Schoen. Representative Vogel.
Yes.
Representative Zerwas.
Yes.
With the vote of 5 ayes and 2 nays, the motion passes.
Motion passes. House File 1163 is re-referred to the General Register. Representative Zerwas, House File 1242.
Mr. Chair, members, I guess I don't know where we're headed with this one, so I'll take some guidance.
Yes, Representative Zerwas, we're starting 1242, and you need to move 1242 before the committee.
I will move it before the committee. I just don't know where it's headed, Mr. Chair.
Oh, I'm sorry, Mr. Representative Zerwas. I move that House File 1242 be re-referred to the General Registry.
All right, thank you, Mr.
Representative
Chair. That'll be my
Zerwas.
motion. Mr. Chair, members, there's an A1 amendment for House File 1242. I will move that amendment.
Does everyone have that amendment?
Yes.
Any comments or questions about the amendment? Seeing none? Representative Gruenhagen.
So what's the primary purpose of the amendment?
Representative Zerwas.
Mr. Chair, members, the A1 amendment is some cleanup language following, I think, to match what happened in the Senate, is my understanding. Yep.
Any additional questions, comments? With none, all in favor of the A1 amendment, say aye. Aye. All opposed, say nay. The amendment carries. Representative Zerwas.
Mr. Chair and members, I'll keep it brief. The city of Minneapolis found itself in an interesting situation. They reorganized the unit that does some of the parking enforcement in the city of Minneapolis outside of the police department and into the Department of Administration. One of the roles that that unit has is to enforce handicap parking enforcement. And under 169.345 and 169.346, right now, under Minnesota state statute, they don't have access to enter in a serial number from a hanging handicap tag and be able to identify the validity of that tag. That's reserved for a parking agent underneath a law enforcement agency. And so this would allow the city of Minneapolis to continue their handicap parking enforcement. Just to be totally clear, their parking enforcement agents that are city employees call in, read off a serial number on a hanging tag, and they aren't told any medical information or any other type of information other than that the hanging permit is valid, or it's expired, or it's fraudulent. And I think I do have a testifier here that monitors that program, and I'll turn it over to the testifier.
Very good. Thank you. Welcome to the committee, and please state your name for the record and go on with your testimony.
My name is Clara Schmidt-Gonzalez. I'm Deputy Director with the Parking Enforcement and Traffic Control Section for the City of Minneapolis. Due to recent changes to Chapter 13 of Minnesota statutes related to data privacy and recent interpretations of who can access disability permit data, we had to change what had been a fairly long history for us of enforcing misuse or abuse of disability permits. We used to write around 209 citations for misuse or abuse of these permits. In a year, now we're down to 2 tickets. And that was a case where it was just entirely clear that it was a misuse of a certificate. Prior to that, our department had a long history of enforcement of these types of activity, and the enforcement was appreciated by those who legitimately use such permits and need the spaces that such permits authorize. The change before you allows parking enforcement personnel of a home rule or statutory city and towns to access data related to the status of a permit, not including medical data, for the specific enforcement purposes of 169.345 and 169.346. Each of those statutes currently refer to parking enforcement and give us responsibilities for reporting, for instance, to public safety and the Commissioner of Public Safety for misuse of these types of certificates. However, we can't do that any longer because we don't have access to the data. The change that we're proposing is supported by the Minneapolis Advisory Committee on People with Disabilities and the State Council on Disability, and we ask for your support on this.
Thank you for your testimony. Are there any member questions for this testifier or for the bill's author? Seeing none, is there anyone in the audience that wishes to testify for or against this bill? Seeing none, I renew my motion that House File 1242, as amended, be re-referred to the General Register. All those in favor, please signify by saying aye. Aye. Opposed, same sign. You're on your way to the General Register. Thank you, Representative Zerwas.
Thank you, Madam Chair. Thank you, members. And thank you for being flexible, as I was supposed to be at 3 places at once.
No worries. All right, Representative Considine. Welcome to the committee. Yet another empty-handed freshman. We do have House rules. They're not just committee rules, but House rules now that we've adopted, all the senior members have, that freshmen have to bring a treats before each committee that they have never presented to before. So we've had a lot of delinquent freshmen this morning, or this afternoon and evening, so.
My apologies, Madam Chairwoman. That was explained to me, and I did do it on the first one. I didn't realize it was each committee, and so.
It is. Yeah. We're having to educate a lot of freshmen on this bill.
I
on this,
beg your
law.
pardon.
The
I'd also-
consequences are just your bill doesn't get to be heard, so.
That's,
You waited all this time, sorry. No, we're just kidding you. Okay.
well, actually, I would like to thank you for getting this in, and Representative Kelly. Ideally, I would have had this in several weeks ago, and I understand that you are making an effort to get this in, and I really appreciate it.
All right, sounds good. Okay, we do have the bill before us then, and I will move House File 166, well, actually, we'll let Representative Applebaum, he would like to move House File 1669 to your bill, Representative Considine, and tell us about it.
Thank you, Madam Chair. I was contacted by a constituent, Mike Colas, and he has been supporting his family for some time by going down to Indiana and acting as an independent businessman, transporting RVs from Indiana to various dealerships in Minnesota. And last year, the transporter license, I understand it was probably always the case, but they started putting on the transporter license good only within the state of Minnesota. So he has no way to continue his livelihood. I did try to call driver and vehicle services and talk to them about some way to fix it. It was not a fruitful conversation. So I have, and they have some legitimate concerns. The transporter license was being abused. They talked to me about a line of cars in Florida, I believe, that were all stolen, that all had Minnesota transporter licenses. They mentioned one on the East Coast where it was connected with human trafficking. So there were some appalling reasons that they had done this. Well, the reasons were appalling, not that they did it. Tried to figure out a way to work with that. I have tried in this bill to address those concerns. They include a background check, I believe a state, tax returns that show that they're a business. They have to prove that they're a resident of Minnesota. They would have to show a tax ID number so that we know that this is a legitimate Minnesota business and that they can, thank you, before they actually would issue the license plate. I had thought this was just pertaining to my constituent, but just before the end of the session, Representative Tice came up, and she has the same problem with somebody that has been transporting school buses in her district. I think the figure she used was $300,000 is what they were having to do to transport, but you'd have to ask her about that one. She was talking to me on the fly. So, but she was going to author a similar bill, but after looking at the one that House Research had helped me with, thought it covered a little bit better than the one she was planning. And so I guess that's about it.
All right, very good, thank you. Are there any member questions for this test for Mr. Representative Considine? Oh, Representative Schoen, look at you, right here.
Representative Considine, Madam Chair, Representative Considine.
Considine.
Considine. I'm
Sorry.
sorry, you can call me whatever you want tonight. I don't care. I apologize. I just want to look through because I thought I heard you say that they had to be a Minnesota resident, that the applicant had to be a Minnesota resident. Now, I don't necessarily see that in the language.
Representative Considine.
Dine.
I would have to go back through and look for it. That was something that I had suggested to House Research when they were doing it. I will tell you that I had several other ideas that I know are not in here. That may be one of the ones that got omitted. But yes, it was going to be, they had to be a Minnesota resident, and they had to have a Minnesota ID number. See if I can find it.
Representative Schoen.
Madam Chair, Representative Considine and
Oh, you approve of valid?
Representative Hillstrom is chomping at the bit, so I do have a further question, but I'll see if she has something to say, if
I
it's
believe-
okay.
did you-
Or Ms. Mullen.
Ms. Mullen,
Oh, she's
go ahead.
shaking us off.
No.
She doesn't want the fast pitch.
Is it just not there?
I have never read this bill before.
Okay.
Madam.
Okay.
I
Mr.
see
Gary had to
principal,
leave, so-
I see principal place of business.
Yes, that's,
Representative
I'm sorry.
Johnson, did you have a comment to this point, or a different question? Different question. Okay, very good. All right,
And actually, I was just trying to clarify, if you said that was your intent, I was hoping
No,
it wasn't in there
that's-
because, I mean, if I was on a border and somebody had a business in Cottage Grove, but they actually lived in Prescott, that their business would still be able to get this if this law passed.
I
That's
believe it just says.
principal place
a
of
principal
business. I just
place.
wanted to.
And again, I'm sorry, yeah, that was one of the tweaks that they gave me, was that the business be primarily located in Minnesota rather than their residence.
All right, I do see we have some folks from DMV up here. If they know the answer to that question, perhaps, I don't know. I think the bill just says that the principal place of business has to be here in Minnesota. Is that your interpretation? Thank you for coming and waiting all evening to be here. Go ahead, state your name for the record and your affiliation, and go ahead.
Thank you, Madam Chair, members of the committee. I'm Thomas Henderson, the Program Director for Vehicle Services with DVS. It's our understanding that this proposal is for a Minnesota-based business.
Thank you. Is that good enough for you, Representative Shaw?
Yeah,
Is that good for you?
I'm
put me
sorry, I
back on the
missed it.
list at the end. I would just like to hear some further information of what DVS, you said there was some issues. What is your position on it now, if I may, Madam Chair? I'll go to the back of the list if other people have
You
questions.
bet, you bet. Well, since they're here, we'll ask them. Go ahead.
Madam Chair, members of the committee, the statute 168.053 has always restricted the transporter plate to within the state of Minnesota. In 2013, the legislature changed the language from within the state to specifically say in the state of Minnesota. After that change, DVS redesigned our license plates for the transporter plates, and it specifically says in the state of Minnesota. I have a sample if you'd like to see. But as you can see, it clearly says valid only in the state of Minnesota. But again, I do want to emphasize that this plate has only been allowed by statute since at least 1994 to be restricted to the state of Minnesota.
Yeah, so I'm not clear on if you're saying that if you attach that to a vehicle, can it be used if they go to Indiana and transport vehicles back here? Then that's my question.
Madam Chair, members of the committee, no. It would not be allowed outside of the state of Minnesota. We have other states are aware of our law. Recently in 2014, the state of Florida, the roadside enforcement stopped a convoy of 20 vehicles, commercial vehicles, at one of their roadside stops, each one of them bearing this plate. This plate is designed to transport trailers and motor vehicles within the state, normally from a manufacturer to a dealer, or from a dealer to a dealer, or perhaps a dealer to a new owner. It's not designed for out-of-state use to Florida, in this case, a convoy of trucks carrying general cargo.
So then, sir, is this bill brought to us, that's in front of us today, is this something that you're opposed to then?
The department has some concerns with the bill. The background checks required is pretty extensive. It's not required for any other dealer category, and there are multiple dealer categories that we license. This falls into a dealer category, though they are not a dealer. But no other dealer category has this extensive amount of background checks. The other concern we have is this proposal essentially makes two different license plates. One that a business located within the state of Minnesota who undergoes the background check would receive a license plate which would not have the restriction that would allow this license plate throughout inside the state of Minnesota and out, while out-of-state transporters would have to have this license plate that is valid only in the state of Minnesota. Our concerns are with that restriction, other states outside of Minnesota may not grant reciprocity and may not accept this license plate in their jurisdictions because we have two different standards for both an in-state and an out-of-state. For example, if a carrier in Indiana wished to bring trailers from Indiana, an Indiana-based business, bring trailers from Indiana to Minnesota, they have to get the Minnesota plate. It's problematic that the state of Indiana would grant reciprocity to this Minnesota plate. And those are our two concerns.
Madam Chair?
Thank you. I think Representative Hillstrom is next on the list, if she's still with us.
Well, Madam Chair, I really was going to answer the question about whether or not you had to live in, but my question is, what section really applies to this committee and what section should be worked out in public safety or transportation, or if we could get to
Ms.
the
Mullen.
civil law?
Chair and representatives, I believe, my understanding is that the bill is here to deal with the issue of the background checks and the data related to the background checks. So the reference to the data is in section 1, and then the classification of the background check data is in section 4.
All right. So let's focus like a laser in on that.
So, Madam Chair,
Representative Schoen.
if we don't do so just to focus on that piece of the bill, and then we can deal with the other areas, because I would have some questions about, and maybe you've talked about it, but how we would help his constituent and what he could do, but we don't need to talk about that here. So if we don't do background checks for license plates in other areas, it sounds like we should just strike that section of the bill and be done with it.
Representative Considine.
That was put in there specifically to deal with I'm sorry, your organization?
Driver and vehicle service.
Driver and Vehicle Services is concerned. We wanted to make sure it was really a very tightly controlled license plate. I believe that the license plate that the gentleman was talking about is not a transporter license, but it's in transit. It's a slightly different one that the dealers have, but for a small independent guy, there's not another option.
All right. I'm sorry, what was, from Motor Vehicle Services, what was your last name?
Henderson?
Henderson. Mr. Henderson, so I guess to Representative Schoen's question, well, and back to one of yours too, because you were saying that the, what am I trying to think here? Yeah, thank you. The background checks. You were saying that those would be expensive, but was it from your advice that Representative Considine put this in the bill? No.
No, it was not.
Okay.
Madam Chair, I said they would be extensive, not expensive.
Oh. I'm losing my hearing too, that's great.
It's late.
All righty, further questions, Representative Hillstrom?
Thank you, Madam Chair. So, really the question is this background check much different than what we require in other areas of the law? And are we classifying the data of the background check? Whether or not we should do a background check or shouldn't do a background check if we do this kind of license, we could debate, all night. So I guess I would suggest that we look at the actual, is this kind of our standard background check? Do we want it to be a standard background check? And is it what we do with data typically? Or is it outside of the realm? Because whether or not they issue these plates and whether or not they require all of this stuff might really fit better into the public safety section. And I just think we should figure out, does this background check meet our standard or not?
Well, I know we have some law enforcement personnel around here, and we have a prosecutor, and we have Mr. Henderson. So what I hear Mr. Henderson saying is there's probably no background checks done for no other license.
Madam Chair, members of the committee, we do background checks on all dealer applications. There are online background checks conducted through the BCA.
But it's not going to necessarily be the dealer that's transporting the vehicle.
Madam Chair, members of the committee, again, we have multiple categories of dealers. So when I use the word dealer, in this instance, I do mean the transporter or in-transit plate
All right.
dealer.
And is this the kind of background check that you do, the one that's listed in this bill?
Madam Chair, no, that's not.
What kind do you use?
Madam Chair, members of the committee, we use the BCA's online background check. It does not require fingerprints, the criminal wants and warrants, et cetera.
Okay. So I think we're starting to peel back the onion here. So it sounds like perhaps Representative Considine, before you get to the next committee, or maybe we can even have a motion here that we change the background check that you have listed in your bill to line up with what is in current statute for other dealers.
I've got no problem with that, as long as Vehicle and Driver Services feel that it's sufficient. Again, this was put in there to address their concerns.
All right. So, Mr. Henderson, would you be agreeable to working with Representative Considine on that?
Madam Chair, members of the committee, yes. Again, and just to reemphasize, DVS does conduct the online BCA background check for all applicants for this.
So it's already being done.
That's correct, Madam Chair.
Representative Hillstrom.
Thank you, Madam Chair. In consultation with staff, the question is, if we delete Section 1 and Section 4, does it then default to the background check that you otherwise already do?
Section 1 and Section 4. Mr. Henderson, whenever you have an answer there.
Madam Chair, members of the committee, yes, we believe so. It would conform to the current online background checks that we conduct with the BCA if these two sections were stricken.
Okay, so. Right. I'm wondering about Section 2 that has all the list of qualifications. And that's where you see on line 2.15, that's where you see provide fingerprints and criminal background check, Bureau of Criminal Apprehension, all that stuff.
Maybe we need to delete lines 2.15 and 2.17 as well.
Okay.
And we have to tweak 2.14. We'd put a period after background check period and then strike line 2.14 as well, under subdivision 1A, because we're deleting 1A.
Section 3 also? Yeah, and then yeah, okay. So Representative Hilstrom, would you like to restate that?
Certainly, Madam Chair. So, Madam Chair, I would make a motion that we delete section 1, that we delete on line 2, or page 2, line 2.13, we'd put a period after the word check, or a semi-thingy.
Semi-thingy?
Sorry, the colon thingy that's there,
All right.
and then we delete line 2.14. And then we would delete line 2.15 to 2.17. But we'll leave the word, the and has to
And.
go somewhere. Leave the word and.
We'd have to renumber
Yeah.
and so forth.
Put the and where it belongs. And then I think that takes care of it. After we delete section 3.
Is 2.18 necessary, because is the $10 administrative fee for the BCA fingerprint checks?
So, Mr. Chair, and Representative Schoen, I would say let's leave the $10 in there because it's a finance committee that will take care of whether or not they have to pay for it or not. And I wouldn't want him to have an unbalanced bill.
Yep,
We don't have a fiscal note.
yep.
And Representative Hilstrom, is it your intentions to delete all of section 3?
Staff, is it my intention to delete all section 3?
Or just delete the first sentence?
Keep the first sentence.
It's
Okay.
section 4, sorry, not section 3, right?
Okay. Yeah, because section 4 talks
Yeah.
again about a background check.
Right. Do we have to do 3 too? Yeah, so it's section 3 and section 4, and then we're done. No, we still keep it because the data, we're classifying the data of a background check. They
Well,
still,
the glass, yeah, the
we're still
data's
keeping 4.
private.
Yeah, we're still keeping 4. So that's the end of my, I'm going to stop, Madam Chair. I apologize.
No, that's okay, I appreciate your help. So, is that clear to House Research what we're doing? Clear as mud. Okay,
Alex, you okay with it?
So Madam Chair, if I could just make it clear. So in the event that we don't have it 100%, given this late hour, we want to make sure that staff has the ability to help us get it right. We want to eliminate the background check section that distinguish it and make it what their current practice is under current law. And we think we do that by eliminating section 1, by making those changes on page 2 that I outlined, and by eliminating section 3, you said? By eliminating section 3. We believe that that defaults to their current background check system that we do. And we're classifying this, continuing to classify the background check data as private, as we do in all others. So if it's what we do in all other, I'm not sure if the language is required, but
belt and suspenders is okay with me on
I would
that.
rather keep it in. So that's the intention of what the amendment does, to just make it default to the current background check system that they are currently using.
Ms. Mullen?
Chair and representatives, my only question would be, does the first sentence of section 3 need to remain in? Because that's the sentence that requires them to do the regular background checks from the BCA. It's,
Mr. Henderson, I'm assuming you do the, who's having conflict?
They're asking, sorry.
Mr. Henderson, so in your opinion, do we keep the first sentence of section 3? Is that addressing the issue of the kind of background check that you normally do with other licensures?
Madam Chair. Madam Chair. Oh, Madam Chair.
I'm sorry, Mr. Henderson?
Madam Chair, I'm sorry, could you restate the question?
Okay, so the first sentence on 2.33 of section 3, subdivision 1A, my question is, would that, keeping that language, bring it into alignment with whatever your current policy is? And then we have another question about cross-reference? Okay. But I thought we were striking under subdivision. This is why we don't. Okay. Okay, so it looks like we need to keep up to our first sentence. But it may need to keep the language on 2.14 that represent, or that cross-references 1A down in 2.33.
Don't we delete 1A? Oh, no, the subdivision 1A in section 2.
Okay.
Basically, our goal is to get to this, whatever the standard is that they already do, which we would approve. And if we find that the language is not perfect after we amend it tonight, we can put that on in public safety. And that wouldn't require it to come back because that's the standard anyway that we're trying to get to.
Right, it's going to
Yeah.
transportation,
Or
so,
we're in
yes.
transportation then too. So then we could just,
We got a number of us from public safety
But it's going to transportation.
and transportation.
they'll fix it,
Do you want me to read?
as long as it's standard.
Yes, Ms. Mullen's going to read it back to us, and
Chair and Representatives, the oral amendment to House File 1669 is to delete Section 1 from the bill, and in Section 2, to delete lines, on page 2, delete lines 15, 16, and 17. On page 2, line 35, delete the. And on page 3, delete lines 1 through 17.
any questions on the oral amendment as stated? Representative Considine, I would just encourage you to go over this again for sure to make sure that we got everything that, and that the bill does what you want it to do, what you set it out, what it was set out to do. And with that, Representative Johnson.
Madam Chair, I just got a couple questions for Department of Motor Vehicles.
Okay.
And if, I think I've waited, that we don't even have to do this bill.
Okay.
Currently, Mr. Chair, Madam Chair, I should say, do you have to have a dealer's license to do these things? To use the transporter plates?
Madam Chair, members of the committee, yes, a transporter license.
Representative Johnson.
Okay, Madam Chair, if we required to have a dealer's license to have transporter plates, that they could be used in-state without a problem, and they could get an in-transit plate for any vehicles going outside the state, is that correct?
Mr. Henderson?
Madam Chair, members of the committee, in DVS, we use the words dealer and transporter interchangeable. For us, they mean the same. It's managed by my same team, the dealer licensing team. Where we start getting into difficulty is the state of Minnesota can't mandate to other states to accept our license plates with commercial vehicles. We do have agreements with other states to allow our passenger vehicles reciprocity, so no passenger vehicle needs to get another plate from another state. We also have reciprocity agreements through the International Registration Program for heavy commercial trucks. There, these operators pay their proportional share of the road taxes and the registration taxes to each state that they operate in. Where we get into a little bit more difficulty is with the commercial vehicles such as this. Each state is a little bit more restrictive on what their commercial what outstate commercial vehicles can do in their state. And that's because those vehicles are not paying road taxes for the use of their public roads in other states. So the long story is the state of Minnesota can't tell another state to accept this transporter plate. What we can do is offer reciprocity to other states that will recognize their plate if they'll recognize our transporter plate.
Representative Johnson.
Madam Chair, is the transporter of the plate the same one that the dealers use for in-transit?
Madam Chair, members of the committee, correct. If a vehicle or a trailer is being transported, and the key difference is the vehicle or the trailer is owned by somebody else. It's being transported from a manufacturer to a dealer. For the dealer plates, and most commonly these would be for the used car dealers and the new car dealers, no, they have a dealer plate that is issued to them, and they can use that plate as a temporary registration plate for vehicles. So they can move those back and forth amongst their lots or to other dealers using that plate and not this plate.
Representative Johnson.
Madam Chair, so the IT plates are no longer in existence? 'Cause the plate you showed, I've never seen before.
Madam Chair and members of the committee, it's the same plate. It used to be called the IT plate, in-transit plate, and now it's called the DRW plate, which is dealer in transit.
Okay, thank you. I was hoping for a solution.
I know, I was hoping so too. Okay, so we have this amendment before us, the oral amendment. All those in favor of the oral amendment as stated, please signify by saying aye. Aye. Opposed, same sign. The oral amendment goes on, and again, Representative Considine, I encourage you to follow up on that as we did it. Considine, as we did it at a late hour with fuzzy minds. So,
I have high hopes.
I'm glad you do. There's no other order of business before this committee. Most likely, Representative Hillstrom.
Pass it on its way. We
Oh,
just
my
adopted
gosh.
The amendment.
All right. All those in favor of House File 1669 as amended, being re-referred to the Committee on Transportation, please signify by saying aye. Aye. Opposed, same sign. Thank you. Members, we're hoping not to have any evening committee meetings tomorrow or next week, but if we do, it'll be Thursday evening. So plan accordingly. Thank you so much for your tolerance here. Thank you. We're adjourned.